Thanks for joining us this week on the show. I know you are going to get so much out of this conversation with Dean Volk, a sciatica relief specialist who, through his physical therapy clinics and now online programs, has been able to support thousands of people worldwide in resolving sciatica pain, as well as issues with low back, with neck pain. When the body comes out of balance and we lose our stability, that's when trouble takes root. And Dean has the key to help you reclaim control of your health, live pain-free, and feel less stressed. Listen in, share this with a friend. If you or someone you know has experienced sciatica issues, there are some gems in this conversation. Thank you so much for joining us this week. It's time to flip the script on stress and learn how to thrive today and throughout your days. Join me for inspiration and interviews with folks who are shining their light in the world in the areas of positive mindset, health, and well-being. I'm your host, Susie Vine. Let's get Happified. Welcome back. I am so happy to have you with us today for a conversation that I think is going to really surprise you as we dig into the topic of sciatic pain. It is something that I have heard so much about from the clients and the people that I work with. It is such a common issue that it actually transformed my guest's practice, and he took it worldwide. So I can't wait to introduce you to Dean Volk. He's an international sciatica consultant who loves to help people find sciatica relief through the correct sciatica pain treatment, which mostly includes finding the right sciatica pain exercises for each individual. He does this without the use of medications, injections, or surgery. With over 30 years of experience as a physical therapist, Dean has developed a simple, effective, common sense approach that has given several thousand sciatica sufferers their lives back. And I can tell you, when I talk with people who have this kind of pain, and if you have experienced it yourself, you understand just how much you are sidelined by this kind of debilitating pain. Since 2018, Dean has supported people around the world through his online courses, membership, and coaching program, Sciatica Relief Now. Thank you so much, Dean, for joining me. I appreciate you hopping online with me today.
My pleasure. Happy to be here and happy to share with your audience what I've learned over the last 30 plus years.
And I know from my experience and the education that I had, I thought I knew what I needed to help people with. And then I discovered where people were really coming from and what their primary issues were. So could you share a little bit about how your practice evolved to have this kind of really specific focus?
Sure. Graduated in 1992 with a master's degree in physical therapy. I started just working in outpatient orthopedic type physical therapy practices, actually became a clinic manager. Year two of my practice, did that for about 14 years at a couple different clinics before opening up my own practices in the Charlotte, North Carolina area. Built up to 3 different practices, wound up selling them in 2020, just simply because, you know what? Owning clinics and working with a lot of people and overseeing a lot of people can be very stressful, to speak frankly. And I had no idea what I was getting into in 2018 when I started a Facebook group for sciatica relief. And that sort of just exploded beyond what I thought could ever happen. And I never thought I would be. I didn't know it was possible to be an online specialist in anything related to physical therapy. But back in 2007, let's rewind it, I went to a course that basically turned my whole paradigm and my whole way of treating clients upside down. Started treating the body more holistically and avoiding the areas of the body of pain with initial treatment. And through that, I developed a sciatica treatment approach that took my 20 to 25% success rate up to about 70 to 75% in my clinics by just simply not doing what everybody else was doing. And that is stretching, digging on, moving, doing core stabilization exercises, which everybody wanted to do for sciatica, because that's how we were trained. And when I stopped doing those things, people started getting better. They started liking the exercises. They liked coming into treatments because we weren't aggravating the problem further, and we weren't giving them exercises that was aggravating and painful to do. We were only working on things that were pain-free and easy, and their bodies started to respond.
And I know from my experience doing massage and body work that we learn early on. People come in and they think they know what they want to receive out of treatment, and they want you to work on the area that hurts.
Mhm.
But it's usually somewhere else that you have to begin in order to really provide that relief. And so I love that you started connecting those dots and found an entirely new approach to something that initially I would imagine some of your clients were a little resistant, but you're not working on what I came here for.
Exactly. And a lot of insurance companies were very resistant and saying, why are you working on the right side of the body when the left side of the body is painful? And one little demonstration that I do all the time for people is I just show them with the towel roll. Hey, you know what? When you have something that's tight, stiff, and sore, why do I want to take and stretch it, make it tighter, and think that it's going to loosen up? Because it's tight for a reason. And usually with sciatica, the hamstring and the butt muscles tighten up to try to protect. And so if that's a result and a compensation in the way your body's tightened, why do I think that I can break the body's natural compensation cycle and make it feel better? So that's a quick little understanding of, hey, you know what? If you're pulling on something that's tight, why is that going to loosen it? Instead, it's going to make it tighter and cause the body to even recoil, so to speak.
Yes, and then you're working against the body, and you really when you're at that kind of friction, there's no progress that's gonna be made easily, that's for
Yes,
sure.
absolutely. Because it takes your central nervous system too and puts it on guard and high alert.
Have you found through your experience and your evolution of your processes a connection through chronic stress and sciatica issues?
Absolutely. Stress is one of the major triggers of sciatica. If you don't have sciatica, stress can actually compress things in your low back so much that it can develop sciatica. But I find more so that when people have any type of sciatica, any type of added stress, whether it be long term chronic, like you said, or even changes in weather that causes the body to have to adapt, or physical stress, emotional stress, mental stress, all of those things play into the intensity of what's going on. And you still need to train the body how to de stress, number one, but also how to balance so that you're putting your body in an optimal position to heal fully.
So it really is holistic. As you were just saying, it's not about just targeting the physical issue, but in your programs then, have you evolved to kind of include stress approaches and resolution to help people see those connections themselves?
We try our best. People are very hardwired, especially here in Western medicine. And you got to take the pill or you got to work on that spot to get rid of it. But yes, we do different breathing techniques, different writing techniques. And actually, 2 months ago, I got certified as an empowered relief instructor. And that's a program out of Stanford that basically teaches your brain how to reverse the pain cycle. So you're retraining your brain away from pain. And real simply, they've done studies against cognitive behavioral therapy, the CBT approach, which takes anywhere from 10 to 15 hours of treatment with a psychologist or psychiatrist. And this is a 2-hour program that has shown to be just as effective. So yes, we take stress and our holistic approach very seriously.
Oh, that's extraordinary. That's really exciting. What a
Yes.
brilliant tool to kind of continue to add to that toolkit. I'm a big fan of the toolkit. Everybody gets to make their own and discover what works for them because there's no one miracle cure out there, no matter how much we wish there were a pill we could take and get to the bottom of it.
Yes. And everybody wants the quick fix. We're in a quick fix society. We wish everything would happen like that. But what I have found is all the generic approaches, and what I call by a generic approach, I tell people, look, if you're going to see a professional and they hand you exercises to do without testing to see if they're actually right for you, or if you go onto YouTube or Google and type in generic sciatica exercises and you see there what your provider has given you, you're basically just sort of fit in this box. Okay, here's sciatica, here's what you do. But I have yet to meet two people over my 30 years, let alone the last 15 years focusing on sciatica, that have identical issues, respond to exercise the same way, respond to breathing techniques the same way. Everybody's body is unique and everybody brings in their own history. So when they're dealing with pain, their body may compensate totally differently. And I've had people say, my MRI looks just like that one and it's identical. I go, yes, but what are your symptoms? And they can be night and day different between people, even though they have the same diagnosis, same specific disc that's herniated, or whatever the case may be. So I've yet to meet two people who respond identically to anything that I do.
That's amazing. And so, how do you find, what do you find is the most beneficial in the clients that you're working with to help them overcome their sciatica issues? Are there character qualities or types that you find are more open to this kind of recovery?
Well, being a type A personality as such as myself, I can relate to when somebody comes in and says, I got to get this done. I'm all in. I'm this. And those are the type of people who I have to say, all right, look, appreciate you wanting to dig in and get it done. But this isn't going to happen faster for you than it does for somebody else who's real passive and calm and quiet about it. So the person who's very type A has to be brought down a little bit because they start feeling better and then they want to go out and do everything that they used to do. And I tell people, look, it takes your body time to heal. A simple ankle sprain could take 6 to 8 weeks to actually heal to get back to doing things. And I have people coming to me, as a matter of fact, the longest standing client he was dealing with this for 63 years on and off. And he, being 83 years old, he wasn't the type A that he used to be, but he started digging in. And within the first 3 weeks, he was 85% better and he couldn't believe it. So I know the approach that I have works. We have people who are very passive and shy. And I say, look, it doesn't matter that you're passive and shy. That's actually better for this because you're going to take this more seriously and long term than a lot of my type A personalities who are just going to get out there and do it. Basically, I tell people, if you're someone who's disciplined, diligent, but mostly determined to beat this, you can beat it when you start applying the right principles and the right techniques to doing things.
And patience just might be that secret ingredient.
Is the secret ingredient, yes. And realizing, hey, you know what? I've had some patients who have done 2 exercises and they were 100%. I can't understand why it happened. Maybe we hit those imbalances just perfectly because basically my approach is 3 steps. First, we want to find the imbalances in your body and fix them. Once your body's balanced, then we want to stabilize it to hold in that position. Because when your body's balanced, your body's in an optimal position to heal. So we don't want to prematurely start the core stabilization and strengthening when your body's out of balance because we don't want to reinforce those imbalances. So step 1 is balance. Step 2, get the body stable. Step 3, slowly and steadily get back into doing your normal routine so that we can make sure that you're not going to re-aggravate it, number 1. But also number 2, if you do start getting aggravated again by doing a certain activity, we can figure out, okay, what is out of balance now that we have to balance and stabilize so that you can get back to doing that safely and wisely.
So it's not a linear process. People start to make progress, and then you do find that occasionally they go too far too fast. They try to get back into an activity before they're stable, and then they can experience a bit of a regression back into some of those symptoms that they thought they had finally cleared.
Absolutely. Yeah, that happens all the time. The people who, my big concern for people is if they feel great after a week or 2, which happens often, but I tell them, look, just because you're feeling great doesn't mean you're healed. It's sort of like taking those really strong pain pills that they're given and they have no pain. So they go out and do everything normally because now they don't have pain. And I try to warn them, look, your pain is just being masked. Your problem is still there. Everything is still there. And if your symptoms calm down because you're taking a pill and you do the things that you know aggravate you, but they're not now because your symptoms are masked, please be aware that it's going to come back with a vengeance when that pill wears off. So I am not against people taking medications to try to calm down their symptoms. I just want them to do it wisely and do it in a way that they're not going to cause more problems for themselves later on.
Yes. I think that, like you were saying before, our Western lifestyle tends to push us to get right back into the game. And we get so impatient. We feel after any kind of restriction that that's enough of that. I should be able to do everything that I've been missing, and I'm going to start it all right now. And then we have to really unwind it again. And
yeah, and we've been taught no pain, no gain so much or hey, you got to push through your pain. And I tell people, look, pain is your body telling you something's not right. So stop. And if you push through pain, eventually that's just going to aggravate things even further. And I always tell my clients, hey, no pain, no gain is great if you're 18 or 19 and you're trying to get into the Marines and you're pushing your body to its limit. But most people with sciatica, for the most part, it starts in their 40s up to 75, 80 years old, even though they may have had some signs early on. Your body doesn't respond like it did when it was 20. Gotta be steady and wise with it. And hey, being almost 60, it's hey, if I go work out now for the first time in a long time, I'm going to pay the price for days afterward, just to sore muscles. And that's not even an injury. So if you have an injury or an inflammation problem or a disc problem or an actual physical problem that's going on, and you try to push through that, it's just going to wreak havoc on your body even more and cause more compensations and more imbalances, which is going to add more stress to your body. And it's just going to be a vicious cycle until you break it.
Definitely. Absolutely. It's hard to get off that hamster wheel, right? That we all tend to fall into. Do you have some tips on how people can, as they're moving through this process of recovery, be building resilience at the same time so they can be a little more resistant to these kinds of relapses?
Yes, the big thing, step one in my program is get your body balanced. Once you're balanced and your symptoms are calmed down, real simple to go through several different exercises to check for imbalances. I mean, my first exercise in my program that I teach everybody is just a simple trunk twist. If your body is out of balance in your trunk, guess what's going to happen? You're going to have different pullings, different stresses in your body that can eventually cause a relapse. So what I tell people who have done my program and are feeling great, I just say, remember the principles. If you notice a little bit of a twinge somewhere, if you notice that something is not just right, go back to balancing out that body, because when your body's balanced, you're able to handle different things that are abnormal, different accidents that happen when you trip. If you have tension in your body like this and you trip, those tight areas are going to resist. The loose areas are going to over move, so to speak, move too much compared to normal, and you're going to damage things. So the more balanced you can stay, the better off you're going to be. And then obviously once you're balanced, if you're stable in that balanced position, you are going to be fine.
And so it sounds like you're also really encouraging people to tune into their body awareness and presence. We talked about breath work already
Mhm.
and that invitation for mindfulness. How do you help people move through that? I feel like we get so inundated with other messages that it can be really hard for us to tune into that awareness. Have you found some little secrets to help people get that phone back in action?
Yeah, I wish I had specific secrets for it, but it's just the redundancy of checking your body for imbalances. And the more you do that, the more you'll start seeing the subtleties of, ooh, that did feel a little bit tighter than this side. Or you know what? I'm not feeling the ease of motion that I felt yesterday on both sides. I'm feeling it only on one side. So yes, it's hard and that's hard for people to just tune in just because we are a society that's, hey, let's get it now. We're busy, we're moving, we've got everything bombarding us all at once. And yes, taking time for yourself and realizing that, all right, if I don't take care of myself, all these other things are going to be meaningless because I won't be able to function and do those things. Because when you have sciatica, it can be massively debilitating. There are obviously different levels and different intensities that people experience. But when someone has sciatica and their legs on fire, and every time they go to sit, aggravates more, or they go to stand up, and then they can't stand and walk, or they try to drive a car, or they try to hang out with their kids or their grandkids on the floor, and they realize, I can't do these things anymore. That's when they start to realize, oh, I need help, because if I keep doing this 6 months down the line, how much more am I going to be debilitated? And it's tough. And it's tough to get people to slow down because once they start feeling better, like I said, they're going to go back and try to do everything all over again without going through the full process of getting balanced, getting stable, and then getting back into normal activity.
Yes, absolutely. I'm thinking of the client that you mentioned earlier, who it sounds like it started very early in his life and lived with it for decades, for 60 plus years. And that has been my experience. I've had a couple of fleeting lower back issues, neck issues that give me deep empathy when I'm working with someone who has chronic pain, because if you haven't experienced it, you will. But to have something like that completely reshape your life, what you're able to even consider doing, you
Mhm.
know, I'm lucky enough to be not working at a desk 40 hours a week. But for many people, if you can't sit in a chair, but you have a desk job, it's just, how you just must wonder how you can even get through the day.
Yeah, it's massively debilitating. So many people lose their jobs because of the inability to sit and maintain certain positions. A lot of people in physical jobs, when they hit sciatica, it's like, all right, how am I going to bend and lift? How am I going to lay tile, lay bricks? How am I going to do that again? How am I going to drive a truck and load and unload? And what's wild is hairdressers, dentists, and dental hygienists, they're always in that bent over position, or the
Mhm.
hairstylist who's always moving, but standing and getting in contorted positions that are not natural, your body eventually is going to say, all right, I can't keep doing this for you without the proper strength and stability going on throughout the body.
Right. Without the balance and without the stability, our body loses that opportunity to recover. It just doesn't have
Absolutely.
that resilience. What are some simple isn't always easy, but what do you find are some habits and routines that people can adopt to help them to have a little bit less stress, to be a little bit less impacted by these kinds of variations, the way the body holds these compensations?
A lot of stress relief techniques, simply getting out in the sun in the morning, getting their vitamin D, walking a little bit if you can walk. And I actually, a friend of mine went through my program. He goes, Dean, I got something for you. I go, what's that? He goes, you need to teach people how to find their OCP. I said, awesome. Can you tell me what the OCP is? It's that optimal comfortable position. And
Mm,
whether you're sitting, standing, moving, whatever position, whatever activity you're doing, try to find the most optimal comfortable position doing that. And that's going to help your body because you're de-stressing when you're laying down. He said it, sometimes he has to put a pillow underneath his knees. Sometimes he found pillow under one knee. Sometimes he found sideline. What's his OCP at the time? He said, but when he found his OCP, it was like he was on a cloud just floating. And there was no tension, no stress going on in his body. And it helped him to relax, helped him to get sleep, which is critical for healing. And so what I try to help people with is number one, you got to learn what your triggers are. What you need to map out your triggers. MAP, what are your movements, activities, and positions that trigger your pain? Because if you keep doing those things, no matter what you do to try to relax and recover, you can't. Because it's like
mhm.
having a scab on your arm and you keep scratching it when it itches. And you look down 10 minutes later, even though it felt good while you were scratching, now it's bloody. Now it's going to have to heal all over again. So if you can eliminate those movements, activities, and positions that aggravate you, number one, that's going to stop the inflammation. It's going to stop irritating over and over again. So if you stop those, find your OCPs, you are going to start the process of healing, even though it may not be fully because your body still may need to get balanced and stable. But by stopping the irritating things and putting your body in a position where it's able to relax and calm, you are going to be a step ahead of most people in this battle.
That's powerfully insightful, I think, in so many different ways, whether it's physical pain, whether it's mental stress, whether it's digestive issues. We tend to get stubborn. Sometimes I call it cranky toddler syndrome. You can't tell me what to do. You
Right.
can't tell me I can't do that thing or sit on the sofa this way while I watch TV. And we have to get back into that inciting incident and find, I love the OCP, optimal comfortable position. Find the trigger, find the remedy for it in that situation, and be willing to make those changes. That flexibility is really important. And I find too, I'm a big advocate of positivity. I find that positive mindset helps too. Is that something else that you help people find or encourage people to find those tools that help them be in that space?
We try, and actually a lot of what I learned and instructed in the empowered relief course that I told you about earlier from Stanford, that is one of the major components. Basically, negative thinking is going to cause your body to have negative reactions. It's going to drag everything down. Have positive thinking. I'm not talking about out there just being Looney Tune about it, where some people take it from my perspective, but it's like, hey, you know what? If you realize that you have pain today, your mindset can be, oh man, here's another day. It's going to be horrible. I can't stand it. I don't know what I got to do to get over this, versus going, hey, you know what? I got through this yesterday. I know I can get through it today. Just a simple shift in your mindset can have a massive impact on the way you experience pain, on the way you deal with pain on a daily basis. So yes, having a positive mindset and looking at things from, I just say, hey, in the same way you want to avoid triggers, you want to avoid letting your mind control the negativeness of what's going on, because everybody's got something going on in their life. And if everybody just turned into the woe is me, and I mean, it'd be a very dark place to handle with people just in general. And I keep on looking back at the screen. It says the Happified interview. And it's, yes. And it's not necessarily being happy all the time when things are bad, but it's, hey, you know what? How can you get to a better place in your mindset, in your physical body, in your emotional condition? I mean, it has a huge effect.
And I agree. And I thank you for bringing that up. I try to, at many opportunities as I can, recognize that there is toxic positivity. There is that faking it, that pretending nothing is wrong, and trying to gloss over things when there's a real situation festering underneath, right? And pain medications for issues like sciatica can be an example of that. You know, we try to over medicate it and maybe book a bunch of massages and keep glossing over the issue. And you're just perpetuating the issue because you're not making that space to be present and honest with yourself and get curious. I think curiosity is powerful. And I think too, when it comes to happiness and positivity, those can be really loaded words for some people. Just finding contentment or peace of mind can be a radical shift, especially when you're navigating chronic pain. You think every day is going to be as miserable as the last, when, as you said, you can look at it as, I got through yesterday. I had the tools, I had the resources. I was able to get a little bit of rest. I can do some things today to support myself. How can I improve this, as opposed to, let me start counting all of the ways in which my life has been limited, restricted. This pain is getting the better of me. You know, there's different trajectories we can choose.
Yeah, mindset is huge. And when you're dealing with any type of problem, am I going to attack it? Am I going to do it the right way? Or am I going to let it just wear me down and stop me in my track?
I like what I'm hearing you say about that moderate approach. We tend to be people who feel like there's ends of the spectrum and we have to be all the way on or all the way off. You know, it's right or it's absolutely wrong. And as you're talking about people finding that balance and then being patient with the process of rebuilding stability, there's that middle road. We can start getting back into the activities that we enjoy, but we're not going 0 to 60 miles an hour and diving back into it. So making peace with that part of the process where we have a little space, we're still gentle with ourselves. And I keep coming back to curiosity too, building that awareness. What is my optimal, comfortable position? What are my triggers? Is so insightful, because we are our own best guides. We know our body better than anyone else. We can go to the experts, but when we give control to them and we stop listening to that inner guidance, I think so many people perpetuate things and find themselves decades later treating this sciatica issue they've never been able to resolve.
Very true. And that's one thing with all the programs that I do. I try to teach people, and I repeat it over and over again. Look, this isn't just a one-time, hey, do the exercise and you're fine. I want you to apply this to your lifestyle. So, simple example, if somebody's walking down the grocery store aisle with a cart and they notice that something's going wrong, I said, hey, you know what? Twist a little bit to your right, twist a little bit to your left. Does that handle it? Does that calm it down? If it does, use that. What I do with my testing is I always have people test right side versus left side, no matter what the movement, no matter what body part it is. So I go through and see, okay, are we in balance? So if you apply that to everything in life, and you start moving and going, hey, you know what? This is easier. Your body wants to help you move with the least resistance, with the least pain possible. And you can assist it by a little bit of a twist, a little bit of an arm elevation, a little bit of a head tear, twist, whatever it is, you can assist your body to find that OCP while you're doing an activity. Guess what's going to happen? Your body's going to relax. You're going to be able to get more done in quicker time without causing damage than you would if you just try to push through and plow through.
Definitely. We can be on the same team. It doesn't have to be this kind of adversarial relationship that we have, trying to force our body into compliance and get back to what we did when we were in our 20s.
Absolutely. Yeah. And what you just said makes me think of something else. A lot of times when people have sciatica, they have a side bend to their trunk or their hip is just shifted to one side. And what I was taught in school was, hey, you know what? If someone's shifted, you need to shift them back. That's what I did for the first 14, 15 years of my career. And man, it hurt people. And now when I tell them, really, your hip is shifted to the right? You know what? Shift it farther to the right and tell me what happens. And they go, oh, that feels so good. They said, but I don't want to walk around like this. I said, I'm not asking you to, but I'm telling you right now, your body's saying, hey, I want to do this. Why? Because that's comfortable. If you take it further, what happens? They go, oh, that even feels better. I said, good. Hold that for 10 seconds. Do it a couple times. And then try to stand up and see what happens. They go, hey, I'm standing up a little bit straight. I'm not as crooked. So you're able to get people's bodies functioning better and looking better and not so contorted by actually contorting it further instead of trying to force it into a position it doesn't want to go.
I really love that. I hope that folks will take on that curiosity and maybe give that a try. You know, as you've been talking about comparing left side to right side, you mentioned comparing how you felt yesterday to how you feel today. All of that awareness, I think, is a superpower because our body has limited language. We might feel hungry because we're hungry or because we're dehydrated or because we're stressed out and our body is craving sugar to manage the stress. There's so many needs our body has, and it doesn't have much in the way of language. So the more we can engage with it and be curious, the more insights we can receive there.
Absolutely. Yeah, the more familiar you become with something just doesn't feel right, and then being, like you said, curious to try to figure, okay, what's underlying that? Because so many times the symptoms that we have are a result of us ignoring the sort of warning signals that I like to say. That's why pushing through pain is like going, if your car says you're on empty, would you continue to push it, or would you go, all right, I need to stop and I need to refuel? Your body is the same thing. If you're in pain, that's your gas tank going, hey, time out, you better stop. Don't push through it. The only thing with the body is you can continue to go. And with the car, the gas is going to stop you eventually. But if you don't heed that warning, your body will break down and it's going to stop doing what you want it to do. So in actuality, it's very similar.
Yes, yes. I've often told people the body will start issuing requests. And if you're not hearing them, it'll start issuing demands. And that's when we're sidelined. That's when you've really got serious recovery that you're really going to have to take the time and make some sacrifices, change your lifestyle to work through because you missed the cue. You missed the light turned on the gas tank that said, it's time to get some service here.
100%. That's very, very true.
So I'd love to hear a little bit about how people begin to work with you. You have your Facebook group, which is, I would think, an amazing point of introduction to start seeing the way that you operate, the insights that you share. How can people connect with you and what's sort of the process that you like to bring people through?
I basically have a couple advisors that have a schedule, talk to people from anywhere from 35 to 50 minutes just to find out their story, to make sure that we're a good fit for them. Because obviously there's people that think they have sciatica and it may be something else. And so we try to just let them know, hey, you know what, this probably isn't the best for you. We don't take everybody just simply because it doesn't seem like a good fit. And we typically just send people directly to one of our advisors who know everything about what we do and how we do it. And if they need extra, then I'll jump on a call with them as well. But we have different programs where we have an online portion of a program where you're doing those exercises, breathing techniques, writing techniques, whatever's going on during the week. And then once a week, you're either, whichever you choose, you want group coaching or one-on-one coaching. And obviously there's costs involved with that. So once a week, you meet with a coach to ask questions about online course that you're taking yourself through. And then the coaches can personalize it for you, change things up, add things, take away, and make it much more individualized for you. But as I said, initially, I created the do-it-yourself online course because people just said, Dean, why don't you create a course? And so I did, and we've changed it multiple times over the years. But when we were doing just the do-it-yourself course, people started having questions. And so I started doing the coaching initially. And then when it started getting to the point where we had people doing the do-it-yourself and then one-on-one and then group coaching, I just went, I didn't sign up to make myself work 80 hours a week. So I hired 2 coaches who know my system inside and out. One of them actually recovered from sciatica herself using it. And the other one has been using these techniques for years. So most of my business now goes through my coaches. Go easy to get in touch with us. As a matter of fact, I'll get you a link for people to look at and sign up for an online strategy session with one of my coaches. But they can find me online under Sciatica Relief Now. They can look up Dean Volk, physical therapist, sciatica. I have a book on Amazon called Sciatica Relief Now. I try to keep it simple because I'm pretty simple-minded. If you want to find me on YouTube, look up Sciatica Relief Now. If you want to find me on Instagram, Sciatica Relief Now. I have a business page on Facebook, Sciatica Relief Now. Hopefully, if you look up Sciatica Relief Now, you can find me.
Well, and I think keep it simple, sweetheart, right? It's what people are looking for. And like you said, you often see people, might have been from our earlier conversation, who have been through numerous doctors, physical therapists, massage therapists, acupuncture, chiropractic, the whole shopping list. And when they're at the end of the rope, it's pretty fascinating. They'll usually get lucky enough to stumble across a holistic approach that brings them back to that personal awareness, giving them the tools, learning the exercises that give you that stability, recognizing when you're coming out of balance. So Sciatica Relief Now sounds absolutely perfect. It's a way to be visible and present and ready when people are looking for that solution.
Yeah, what I'm trying to do, I'm trying to empower my clients to take their health back. I'm teaching them how to find the imbalances. I'm teaching them how to fix the imbalances so that, hey, you know what? I was a business owner. I had 3 clinics. And yes, I wanted people coming in 3 times a week for 2, 3, 4, 5, 6, 10 weeks so that business can keep going. And once I learned these techniques, I realized, all right, people don't have to come that much. And once I teach people these principles, whether it be sciatica, and I also use a lot of these principles for people with neck pain, shoulder pain, knee pain, hip pain, similar principles because the body responds the same way to when it's balanced. But obviously with these sciatica clients, I'm telling them, look, you've been dependent on a doctor for medication. You've been dependent on a doctor for injection. You've been dependent on a chiropractor to snap you. You've been dependent on decompression treatments to pull you. Wouldn't it be nice for you to be able to learn a system, learn some techniques that you can take the power back so that if you feel something, you can go, hey, let me check to make sure my body's balanced. And if my body is balanced, let me make sure it's stable. Most of my clients right back years later go, Dean, I can't believe it. I felt like I was starting to get a flare up like I have been over the past 20 years. I did a couple of the exercises, it's gone, or I've never had a flare up since. And that's what makes me happy. I don't want you to want me. I want you to need me initially to teach you, but I don't want this relationship where if something happens, you have to come back to me. I want to empower you to take your health back, to take charge of your body.
Beautiful. Yeah, there are plenty of people who are seeking relief. We don't need to keep people hooked to the weekly visits and calls and tune-ups, especially when they have that awareness and say, oh, and I used my exercises and I released that and I'm back in balance and I'm full speed ahead.
Absolutely.
Marvelous. Is there anything that we didn't get a chance to talk about today that you want to make sure people know?
The only thing is, if you've been dealing with back pain or sciatica and you've been doing the same thing over and over again for weeks, months, and years, my rule of thumb is I tell my clients or I tell people who talk to me, I go, if you have not felt any type of change in 3 to 5 sessions with whoever you're going to, whether it be a PT, chiropractor, acupuncturist, massage therapist, a doctor who thinks that they know what they're doing, or an osteopath, if your symptoms aren't either less intense, delayed onset, changing in some way, centralizing in some way, it might be time to start looking for something else. And whether that be with me or not is irrelevant. Find a specialist in your area, because I find so many times people come to me after going to 3 or 4 therapists, 5 or 6 chiropractors, 2 or 3 massage therapists, and basically tell me everybody was doing sort of the same thing with a little bit of a different of a twist. I said, if you want a 180-degree opposite twist, I'm your guy. If you want to keep doing what you've been doing and not getting the relief, keep going. Because there's not very many people out there who I would consider sciatica specialists or experts, just because they deal with everything. And hey, for the first 15 years of my career, anything that came through the door, I was working on, because that's how you build a business. And that's how you keep a business going for the people who you're working for. But once you realize, hey, you know what, there's certain ways that you can treat people with sciatica that are much more beneficial. That's when I started focusing. It's been 15 to 16 years now. And my success rate is even better now than it was when I was able to see people in person in the clinic. And so many people come and go, how can you help me if you can't see me, if you can't touch me? And my question is, how have you been doing with all those people who have been seeing you and touching you? It's like you've been working with them for months. I mean, this gentleman, 63 years, and they only got you so far. Maybe it's a different approach. Maybe it's a different mindset that you need to take on, instead of depending on someone putting their hands on you, digging and poking and prodding and stretching, and going, hey, maybe I need to take control and I can do this on my own. And when people realize that they can beat this on their own, it empowers them. So that's my last gold nugget to share with you.
100%. I'm always thrilled to meet advocates in the less pain, more gain movement, and in inspiring people to reclaim control of their health as well as their happiness. When you're experiencing pain, it's really hard to feel positive about what you're looking at through those lenses. So when we can clear those resistances and resolve the friction, it's amazing. And I hope that people take away from this that you get to be the CEO of your health team. And if your health team isn't helping you make progress, just like you said, Dean, if you're not having benefits from a bit of this treatment, you don't have to go through the entire course that's prescribed. If you're not seeing results after a couple of visits, after a little bit of time with this, then look for better solutions. And I love how available this is, how accessible, really empowering people to develop the tools that are going to serve them. So I'm so grateful we've been connected, and thank you so much for everything you shared today. I appreciate it.
Thank you for having me. It has been my pleasure.
Look forward to future collaborations. We'll have the links to connect with Dean and his website in the show notes. Sciatica Relief Now, everywhere you are online. You can learn more and follow Dean and get more of his awesome insights. Thanks so much, Dean. Take good care.
Thank you, Susan.
Thanks for listening. You'll find all the resources we discussed today online at happifiedlife.com, along with links to subscribe to Happified on your favorite player and a handy search tool so you can search all of our previous episodes. Help us grow by leaving a quick review and share this episode with a friend. Until next time, keep on shining.